Hey guys, welcome back to my channel. Today's video is not a tutorial, it's not a makeup look. I'm just going to be a little bit transparent. I'm going to talk about my thyroid surgery. This is my scar right now. I was diagnosed with multinodular goiter. So let me be very specific. Yes. So I had a multinodular goiter on my left thyroid, and basically what that is, goiter is like a type of mass. Multinodular means that it had like multiple nodules in it, like little cysts, and that's why they call it that. And it's just kind of funny, not really, how all of this came about. I was actually just sitting with my family, and my younger sister, she happened to point like at my neck. I'm just thinking she's being whatever. But she pointed at my neck and she's like, "What's that?" I'm like, "What are you talking about? Like, what's on my neck?" I wasn't never like really paying attention to my neck. And it wasn't until she said that I noticed I had like a lump right here. It was protruding. And I looked at my neck, I looked at her neck, I looked at my mom's neck, I looked at everybody's neck in the room, and that's when I realized, oh, like, y'all don't got that. Like, that's not supposed to be there. So my sister pointed it out, and Mom was like, "Angel, you need to go get that checked out. You need to go. You need to go. You need to go." And I'm like, I don't want to go. I didn't want to go. But some told me like I needed to get it checked because like when I was younger, I had a cyst on my thyroid. So I've had thyroid surgery before. This is my second one. But I was like 10 or 11 at that time. And what I had then was a thyroglossical duct cyst, which is something you get, like some babies are born with it, and then it kind of goes away and it doesn't bother them. But for me, it was like getting larger, and it was actually hurting me. So my parents made a decision at that time to have it removed. I had it removed, and then I had to have reconstructive surgery on the scar because it didn't heal like properly. So I had 2 surgeries with that. So yeah, I did that, and honestly, since then, I should have been like following up with my thyroid. I should have been seeing a doctor regularly, especially because prior to this time that my sister noticed something, I was told that I had an enlarged thyroid like a few years ago. And instead of going to the endocrinologist who specializes in your thyroid, I just like told my like primary care doctor, "Hey, can you like test my thyroid levels?" Like that was me checking on it, right? And the thing is, my hormone levels at the time, they weren't like elevated enough to really see anything. But also, the blood tests that your endocrinologist is going to do compared to what your primary doctor is going to do are completely different. So you really need that specialist to really specifically test for that part of your body. So when I went to my primary, everything came out fine. So everything came out fine. I'm like, okay, cool, we're good. So basically, like, one thing that I have learned throughout this whole thing is like to just check on everything. Like, just be very thorough if you really feel like something is wrong. And another thing that I learned is to research your doctors. I thoroughly researched my endocrinologist. I'm going to put her name down. Her name is Dr. Beckman at Cleveland Clinic, and she was amazing. Like, when I went to my first appointment, she had already looked up my file. She already looked at my information, had like blood work that I'd done previously, like all my stuff on file already. And I like that because it's like she was doing her research on me. She was very thorough. I went through months of testing, doing different types of tests. To be honest, it was very stressful because like I just didn't know like what to expect, and it was scary. Sorry. So it's been hard because it's like you're going through this and you're working and you're like living life, and I'm here trying to like do my makeup stuff, do my modeling stuff, and like be positive about things, but it was a very scary time. But you know, when we made the decision, hey, we're gonna do this, it was basically like, do it now, you're young, you're gonna heal quickly, compared to if you just let this thing linger and you're older, or you get complications, or it's grown so big that it's restricting your breathing, then that's going to be a problem. So I made the decision to do the surgery, and I had to prep for that. And she referred me to the endocrine surgeon. Phenomenal. I love her. And that's very important. She referred me to her, so I trusted her, but I still like did my research on her, just because this is my doctor, this is my body, and I want to be thorough. You know, if you're doing surgery on me, like, I need to know how many surgeries you've done. Like, I just did my research, so that's something that's very important. So I loved my surgeon. Oh my gosh, she was funny. She definitely like took the load off of me. To the appointment with her, and we explained everything that was going to happen. They did ultrasound, blood work, and things like that. And when they did the ultrasound, they realized that the goiter was so large that it was growing into my chest area. So initially, she thought that she was going to have to make the incision like somewhere here. And I had a previous scar from my other surgery. So I was like, dang, I'm about to have 2 scars, bro. Like, I'm not going to lie. I have to be completely honest with you guys. I was thinking about that. I'm thinking about, like, I already used to get pretty annoyed sometimes when people ask me, oh, what happened to your neck, da-da-da, because, like, it was something that I didn't really want to talk about sometimes. So now I gotta hear, dang, what happened to, you got 2 scars in your neck. Like, people used to say stupid stuff like, oh, is someone trying to kill you? Like, is that how come you could sing? Because you got your voice box surgery. Just, like, stupid things. Like, just complete ignorance or whatever. So I was thinking about that, but honestly, I had to just get that thought out of my mind, because at the end of the day, this is something that was important. This is something that needed to be done. I can't think of the cosmetic effects of it, you know? So when she did the ultrasound, she realized that the goiter was actually pushing on my voice box. And that's why I was losing my voice randomly. And something that she did warn me, which I'm kind of experiencing now, is that if you've already been experiencing that, after the surgery, it's going to be a little bit worse. So as far as when I can get my voice back, it's going to be a couple of weeks. Even talking, which this is like the most talking I've done. Even talking for long periods, sometimes I feel winded. Yeah, so apparently my neighbors won't let me be great. They started mowing the lawn. The day of my surgery comes, and all the days prior, I was just a mess, honestly. Just anxious, nervous. You know, I didn't know what to expect, really. So yeah, I was really nervous, but it seemed like the day of my surgery, all my prayers were answered, all my friends and family's prayers were answered, and I had such a feeling of peace over me. I felt like back in high school when I used to do theater, like it was showtime. Like when I saw my nurse, my surgeon, I was like, okay, we've been prepping all these months, like it's showtime, today's the big day. And she was making me laugh, and the nurse was making me laugh, and man, the staff was phenomenal. Like I said, they were just very welcoming and really helped me feel very calm. And the people that were around me kept my mind at ease. I was laughing and everything was good. So that really helped a lot for me. Oh my gosh, it helped me so much. And I'm so grateful because I needed that. You know what I mean? So they come. I checked in. My surgery was for 8 a.m. They did blood work and pressure, vitals, all that good stuff. Got me dressed and ready to go. And we were just like in the waiting area. Because I have asthma, I had to take a breathing treatment prior to the surgery, just so make sure I can breathe and stuff. They had me get Tums because your thyroid, like attached to your thyroid, are these glands that help metabolize calcium. They're parathyroid glands. I really want to make sure that wasn't, yes, see, I know. Parathyroid glands that are attached to your thyroid, and you have 4. So she had told me that sometime in the surgery they get removed. You can't put them back or whatever, and like you'll have to take the calcium to keep your levels regulated. But thank God I didn't have to do that. Actually, my glands were like way all over the place where they weren't even supposed to be, that she had to take them out, rearrange them, and attach them to a muscle. And this I found out after. So that also contributed to a lot of the swelling that I was feeling, because I had that done. And it was like attached to some muscle. That was something that I had to watch for my recovery. Tingling in the fingers and things like that, different symptoms that would show that you have a calcium deficiency, and I didn't experience that, so that was awesome. I was grateful for that. So anyway, they put something behind my ear to prevent nausea that I may experience with the anesthesia. I said bye to my mom and everyone, and I was wheeled into the surgery room. At that time, they had already had something kind of like relaxing me. It wasn't the anesthesia yet, but I was already like just chilling. And before I knew it, I was out. I woke up, I felt really good, actually, bright-eyed. The anesthesia was still there, and the drugs, the pain medicine was still in my system, so that was why I was feeling like good. But no, I obviously had pain. I felt like a pressure in that area, but and pain, but it was not like unbearable. But like I said, I still had like all the medicine in me. My laryngeal nerve on the left side was so like this is how it's supposed to be. So it was like open and swollen due to the trauma, and it was like kind of like having difficulty closing back. This was told to me afterwards. Anyway, that when I drank liquids, it's basically like when you swallow down the wrong throat, so it was like just going straight down, and it was causing me to choke. So that was something that I had to deal with. So I have to drink from a straw and like drink a certain way and drink slowly to prevent myself from choking. Also can't have spicy foods, acidic foods. And I tried to eat something with even just black pepper the other day, and I just started choking, like coughing, choking, and pain. So I'm still not out of the clear for that. You know, it's really hard because I love pepper sauce and I like spicy, and I feel like my food is like super bland. I also had to eat like mashed potatoes and soft foods, and I'm still I'm eating regular food, but things like popcorn, still choky, certain chips, still choky, and that's just because it's only been 2 weeks, so I just have to just pace myself. I did not have to stay overnight at the hospital. My surgery took 2.5 hours, and maybe like 3 or 4 hours later, I was able to go home. I just had my incision bandaged. I didn't have stitches. They closed the incision with some type of like surgical glue, which she told me would kind of come off like as you heal. I am using Mederma. It's what the doctor told me to use as a scar treatment. No exposure to the sun. Emphasis on sunscreen, like, because they don't want any UV rays in that area. So that's what I've been trying to do. My days after surgery, the first day, like I said, I had sore throat. I was feeling okay. I was just super tired, and I think it was still the anesthesia coming out of me. So I feel super tired, super weak for the first few days. And that's another reason why I didn't do this video sooner, because I wasn't really feeling good. I mean, even still now, I get really winded really quickly. Just like doing movements and just going out. So it's still just like a process. My body is still healing. And I still have to take it easy. Obviously my voice, that's something I'm gonna be watching for. She said a few more weeks I should still be experiencing this. Anything after that, we have to like check on it. So we're just gonna pray that everything's good, especially me being a vocalist. We're just loving to sing. Yeah, that's kind of a concern. I still have a little bit of swelling, so they say that that's, you know, normal. On my testing of the goiter that was removed, everything came back. Nothing was wrong, so I'm so grateful for that. And yeah, something I suggest is to get a lot of rest. Get rest, don't overexert yourself. You know, still lifting things are a little bit hard for me. I still can't do that. Still can't work out as of yet. But as soon as I can, I'm ready to just get back into it and get back into my routine. Lifting my head this way for long periods of times, I still am experiencing some pain because my neck is still like it hurts. I have to do neck exercises and massages because, like I said, my surgery was 2.5 hours that I was in this position with my neck, so it's expected to have like some issues with that. So it's like my neck and my back area are like still sore. Like I still need to rest. I still need to like take it easy. I'm ready to be back to normal, but I'm taking my time because I want to be 100% and it's just gonna take time. That's my thyroid surgery journey. I might be giving updates as far as like my scar treatment, seeing how that goes. Mowing the lawn again. This is insane. I hope you guys can hear me. I'm trying not to like have to edit this so much because I want it to be as authentic, as transparent as possible. Ignore all this stuff. This is as real as it gets. My body reacted really well to the surgery. Like, I'm stronger than I imagined. I thought that it would be like a mess, but it's been pretty good. And everyone heals differently, so you know that's something to be mindful of. But I think just having like a positive mindset and just being patient with yourself is really something that would help. So thank you for watching, and don't forget to like, comment, subscribe to my videos. I normally don't do videos like this if you check out some of my other videos. But yeah, man, guys, thank you, and that's about it.